Okay, everybody, it is time for your question of the week, sponsored by Utah Honda Dealers. And today we are asking you about headaches. So how often do you get a headache? 27% says around once a month. 26%, 2 to 3 times a week. Wow, that is a lot of headaches. I actually think I'm right in line with that.
Are you?
Yeah.
Well, Nisha was saying she gets them 2 to 3 times a month, and when she gets them, they're pretty debilitating. Colin McDonald is here. He's a physician's assistant with Wasatch Pain Solutions, and I love it. I got to talk to Colin last time. We talked about pain. Today we're talking about headaches. Right. How common are headaches for people?
So when you're talking about headaches, you have to break them down into 2 categories. So primary headaches and secondary headaches. Primary headaches are one of 3 types. So cluster headaches, which affect about 0.1% of the population, migraine headaches, which affect 18% of the population, and tension headaches, which affect 54% of the population, but could be kind of overdiagnosed because of their prevalence.
Those are primary headaches.
Those are primary headaches. Those are headaches that are coming from the head. Secondary headaches are coming from a separate source. So medications, trauma, including whiplash from a car accident, and most importantly for our purposes, cervicogenic headaches, which mean headaches that come from the neck and then radiate over the top of the head.
Well, we were just eating clean in the kitchen, and I'm wondering if when you eat something, well, probably,
we're good for life.
But if you eat something and it gives you a headache, is that considered secondary? Is that an external factor?
I would consider that a secondary headache.
And that can give you a headache?
I
feel like it does.
Sure. Did that give you a headache?
I feel like sometimes when I eat a lot of sugar, especially early in the morning, I get so many headaches. Yeah.
Sure, and that would be something like a secondary headache from a medication. So people who drink a lot of caffeine, when they come off of that caffeine, can get rebound headaches, or medications that are prescribed to treat headaches can have rebound headaches associated with them as well.
I don't ever get migraine headaches, but Nisha gets them probably 2 to 3 times a month, and she's thrown up from them before.
That's terrible.
It's terrible. Yeah. So what is causing that for her?
So there are
a lot of reasons.
Yeah, I mean, there are myriad reasons why you can have migraine headaches, but the treatments for migraine headaches are usually associated with medication therapy. When medication therapy and things like postural support or postural treatment, exercise, physical therapy, acupuncture, stuff like that is not working for you, then we can kind of start pursuing other courses. You have to have headaches that last more than 4 hours a day for more than 15 days out of the week to start moving towards interventional treatment, which is something like Botox therapy.
So this is a silly question, but I've heard about Botox therapy before, and is it different from the Botox we all hear about often, the cosmetic?
Yeah. So the cosmetic Botox is targeted to keep Utah young and beautiful, and I'll let the cosmetic folks do that. My goal is to precisely target the muscles that cause headaches, and so we're trying to relax those muscles. Botox is technically a paralytic for muscles, but you're injecting a very small amount, which reduces the headache in the areas where you're getting that tension from the migraine. We often find that people get a reduction in the severity, the frequency, and the intensity of those headaches.
So is that a pretty intensive treatment? I mean, how many injections are you getting?
You're getting a few injections. I'm the one that does them. You target several muscles in the front, a couple of muscles on the side.
Where do you put the injections?
So you want a specific?
Yeah.
So procerus muscle, which is right here, the corrugator muscles, which are right here. The frontalis muscle, you do 4 injections across here, the temporalis muscle on each side, and then the occipitalis, and the cervical paraspinals, and then the traps.
Yeah, but
so
I
feel
like I'm looking younger while my headaches are gone.
Most people walk out and look 10 years. I'm kidding. That's not true. But
I know, but I
we
feel
do
like
reduce.
Yeah, you do reduce some wrinkles if you're doing Botox there, right?
That's not our aim.
It's not your aim. I know. No, you're working on the headache. I'm just saying.
She's just saying.
That's exciting. So when do I come see you about my headaches?
So there are 2 kind of take-home points. So if you're resistant to medications, if you try medications and you still have headaches afterwards, there may be some other reason, specifically those cervicogenic headaches. So if you have headaches that are coming from the neck, we can treat those, and you're likely suffering needlessly. Number 2 is location. So if you have a location of your headache that stems from the back and radiates up over the top, it's likely not just coming from your head. There may be a secondary source, again, maybe that cervicogenic headache that we can treat.
So if I'm coming in what can I expect on that first appointment?
So we will diagnose based off of history, the physical exam, and imaging. So we'll likely get some imaging to rule out some other causes of the headache. We'll do a physical exam, figure out where the headache's coming from, but most importantly, we try to listen to our patients. So where is your headache coming from, and then how long has it been going on, and what are the issues with it?
Gosh, I feel like calling people at home with headaches right now are thinking they're so happy that there's something they can do about it.
I hope so.
Really, how do
Hope we
we
can help.
contact you?
You can reach us online. Most people find us via Google. Our phone number should be listed here. We're in South Jordan.
Okay, perfect. Thank you, Colin. We'll put all that information on our website so you too can get help for your headaches. Colin, after I get the Botox, how soon am I finding the relief?
About 2 weeks. You gotta give it 2 weeks.
2 weeks. 2 weeks. That's what I'm doing. All right.
Yeah.
Thank you so much.
Okay.
Coming up next, Nisha's going to take us on a little Salt Lake City Parade of Home tour.